Well, there are several things many families have had to place on the back burner as a result of the financial impact of COVID-19, including insurance. So joining us in tonight's upfront discussion, Director of the Michigan Department of International and Financial Services, Anita Fox. Anita, thank you for joining us tonight.
Well, thank you for having me.
A lot of people have had their lives turned upside down by this deadly disease, including an increase in uninsured adults. Please talk about that impact.
Well, that's right. We saw an increase of an estimated 46% of Michiganders lose their insurance during the early days of the pandemic, their health insurance, which is especially troubling, obviously, during a health crisis. The good news is that we are in the process of open enrollment under the Affordable Care Act, or Obamacare, where residents can take a look at what their options are from now until December 15th. So there's just about another week left. And we learned from last year's enrollment that more than 80% of Michiganders were entitled to some kind of subsidy or tax credit that meant they would get either low cost or no cost coverage.
Wow. So some of those insurance options for people who have lost so much during the pandemic, can you tell us what some of those are?
Okay. So when you lose your job and then lose your insurance, you have 60 days to replace your insurance. If you haven't done that or you're newly uninsured, you have until December 15th to go in, and you can go to michigan.gov/healthcare, health insurance. Let's start over. Michigan.gov/health insurance. And you'll be able to go in through there. You can do a no commitment look around. It'll tell you how much tax credits you get, how much subsidies you could have, what are your options. And the great thing about those plans is we know they're comprehensive plans. They cover vaccinations, preventative care, the kind of essential services you need to keep your family safe. So these are great options for people who've lost their insurance, who were previously uninsured. People think it's too expensive or too complicated, but if you go to michigan.gov/health insurance, you can find low cost, no cost options and local assisters to help walk you through the process for no fee.
Incredible. And you talked about tax credits. So could this mean savings for 2021?
That's right. So through a system of tax credits or subsidies, you might not have to pay all of your premium, some of your premium, none of your premium. So a lot of people get help with what they think might be a high cost of insurance by these government subsidies or tax credits. The only mistake people can make is missing the deadline and not looking at their options, because once this window closes on December 15th, that's it, unless you're qualified for a special enrollment until the end of 2021.
And it seems like, it's so important now to have that coverage, especially in the midst of a pandemic. But it is a bill that many people are having a hard time coming to terms with having to pay when it comes to other necessities in their home. Will you just reaffirm why it's important that we keep up our insurance?
First of all, you're going to have healthcare costs if your family becomes sick or injured, whether or not you have insurance. If you have insurance, you have a way to make sure that your family's protected and you can get the care you need. You can also get your family preventative care to avoid some of those illnesses, or get COVID testing or vaccines or the things that you're going to need to stay safe during this pandemic. And people should not be afraid that it's too expensive, because there are lots of options. And if you go to that michigan.gov/health insurance, if you're eligible for Medicaid or your children are eligible for a program, Healthy Michigan program, it'll guide you right there, or it'll guide you to the subsidies, tax credits. So really, people should not be afraid that it will be too expensive or too complicated. We can walk them through the process. They can contact the Department of Insurance and Financial Services, Google it, call our toll-free number, 877-999-6442 to get help. Live call answered from Monday through Friday from 8 to 5.
And we just had the information up for a virtual town hall where people can get their questions answered. Will you talk about that?
Yeah, we've been sponsoring virtual town halls to talk about health insurance and how people can, kind of get their questions answered and where they go for information. If they go to our website, it'll list all the dates of those. So they can just Google Michigan Department of Insurance. It'll take you right to that. You don't have to remember the whole URL or anything. We also have town halls that we've been offering on auto insurance reform to save you money. So there's a whole bunch of information on that website, or you can call our toll-free number at 877-999-6442.
The information is there, and you can hear about the importance and your options logging on or by phone. Anything else we need to know, Anita?
We need to know that this is the time to do it. This is an important time. We know that access to health insurance leads to better health care. Better health care leads to healthier families. You can't be there for your family. You can't support your family if you're not well. So we really urge people to look into their options. There are low and no cost options, and there is free help available either on the internet or by calling our office. We want to make sure all Michiganders get insured. Start by getting your flu shot, and then making sure that you have insurance for your family.
And we really need that support right now. Anita, thank you so much for the information. We appreciate you joining us tonight.
My pleasure. Thank you for having me.
All right, Alan.